Hey, welcome back to Twin Cities Live, everyone. We're having fun with these glasses, okay?
Monday, yeah.
Today is Blue Light Awareness Day. Yes, a whole day dedicated to the light that is commonly emitted from our screens, like your phones and your computers.
The blue light is everywhere. We spend up to an average of 13 hours a day looking at things that contain blue light, and that's been shown to cause discomfort and maybe some damage to our eyes. So we've got the expert here, Dr. Chu from Chu Vision Institute is back in studio. He's going to explain if these lights are actually harmful and what we can do about it because we're wearing the blue light glasses. Hey, Dr. Chu.
Yes, you're styling here.
I'm glad that you're here. This is like a big thing because we were just talking about blue light with related to skincare on this show about a month ago.
Yep.
And then I started to become aware of how many screens are everywhere. And you're just constantly being exposed to it. So what's happening to our eyes?
Yeah, this is a huge topic. We've learned through studies that blue light can affect a lot of parts of our system, like our circadian rhythm.
Yeah.
It can affect our concentration, and it can also add to digital eye strain. So when you're on the computer so much, you're getting dry eyes, you're getting sleepier, and just not focusing as much.
This is not good.
So what is the blue light actually physically doing to our brains in those moments? Is it blocking something that it's just not allowing the circadian rhythms to happen? Like, what is actually happening?
Yeah, we're actually learning a lot about it still, but there's one gland inside the brain, the pineal gland, that regulates our circadian rhythm, when we sleep, how well we sleep. And that's why, you can do things like, changing when you use your screen time, but we're learning that blue light has an effect on how we live.
Okay, so it is important to maybe take some measures to, like you just said, adjust when you're using your screens. But it's hard at night. Like, it's going to be dark at 5 o'clock here. I don't know if you know this, Dr. Chu, but we're going to have a real dark time here. So, like, when are you going to look at your phone if you're not, like, in the light? Only
Absolutely
at noon?
right.
You have to see it.
One aspect that I see out there, we all use screens to kind of, be our babysitters for our young children.
Yeah.
And so that developing mind is really important. So there are companies out there that have screen protectors and blue light filters built into them. So look for that when you're, like, purchasing these things.
Okay.
As an adult, just take a break. The 20-20-20 rule. So every 20 minutes, take a 20-second break to look at something 20 feet away. It kind of helps reduce digital eye strain, but it also gives you that break to kind of give your eyes and your system a break from the blue light.
Okay. So these blue light glasses that we are currently wearing that you just had on, and it seems like you've got...
My job is to get rid of these.
and you've got a screen protector on that you can put on your phone. So these actually scientifically work without really messing with the vision that you would need to actually view these screens.
Yeah, absolutely. There's, these take long-term studies, so that we're learning more and more about these as time goes on. But, anecdotally, just like you and I were talking before, that, you can feel, when I'm on the screen a lot and I use a blue light glass, it makes me less tired.
Yeah.
Right. And I definitely believe in the circadian rhythm thing, where if you use light too close to your sleep, it's going to disrupt, just like seasonal affective disorder, like Elizabeth was saying.
Yeah, no kidding. Okay, so glasses are a good idea.
Yeah.
Tell us more about these screen protectors. These are cool because this is a Minnesota company.
This is a local company.
Yeah,
I'm actually,
this is awesome.
It's pretty cool because they developed something called the RPF, Radiance Protective Factor, just like SPF for like sunscreen. Oh. So when you look out there, if they've RPF 35 is the lowest protection, but if you're going to be on for playing video games, if you're going to be on a lot of Zoom calls for a lot of corporations working from home, you might want to get a higher RPF factor. So they go up to 90. And so RPF 35 is the minimal safety factor, but you can look for an RPF now when you're shopping for screens and other things.
But then this guy, you just put here, I got a phone right here. So you just stick this on here?
A typical screen protector, yeah, and you can still see through it, really nicely.
Yeah.
And you get the protection without having to put a pair of glasses on.
Okay, this is like a must do.
Yeah, because you know what I would do? I would break my glasses.
Yeah, I know. Them. I have some, and then the kids take them, and then or they're just not in the right spot. This is like a permanent deal. Are they having them for like TVs and tablets and stuff?
Yeah, this company is partnering with big companies that make big screens, like Samsung, Lenovo, Dell Computer are all partners with eyesafe. And now you can just get a screen, a laptop with it built in.
So do you think that's going to be the future? All of our screens are going to have this stuff built in?
I think eyesafe hopes that, but I think that there's more and more information where protecting your eyes. We know about macular degeneration.
Yeah.
Mm-hmm. So protecting your retina health is important. And one other thing you can do, we have a bottle of vitamins up here. There are vitamins that have been shown to protect the retina as well. So not just glasses and screen protectors, but vitamins can help as well.
What's that?
Yeah, what kind of vitamins are you talking about here?
This brand name was actually studied in 2 FDA clinical trials, and it's called the AREDS2. It stands for the name of the trial. It's PreserVision. and you can get it at any pharmacy. But it's an antioxidant vitamin, so it actually reduces the risk of developing severe macular degeneration by like 23%, which is
That's
huge.
incredible.
Yeah,
okay, let me ask you a really silly question. Do tablets, do electronics and screens, TVs, phones, do they need blue light? Like, is it something that like you can't have a screen and you can't project anything without blue light? Can't they just take it out?
Yeah,
Like,
no,
that
that's
sounds
like
silly.
filter it out or something.
Yeah.
And you know, I'm not an engineer in that sense,
Yeah.
but you know, I think it's just part of the whole spectrum. You know, and just like we know, like, you know, not all light spectrum, not all part of the wavelengths are bad. We use light every day through LASIK surgery and cataract surgery to help people see better. So, yeah, I think we're learning more and more about its effects because, you know, relatively, you know, using screens has really just increased in the last, you know, 10, 15 years. And so we're going to see a lot more of this information come
But
out.
erring on the side of like protection is probably smart. And if you're recommending that, if Dr. Chu says it, then I'm in.
Yeah, I think definitely there's no harm in doing it,
Yeah.
and more information is supporting the use of something to protect your eyes and yourself from blue light.
Well, good to see you.
Yeah.
Thanks, Dr.
Yeah,
Chu.
thanks so much.
We
Thank you.
appreciate it. Chu Vision Institute is currently enrolling for a clinical trial. Here we go. That will evaluate an investigational laser technology designed to perform LASIK.
Yeah, and if you
Sounds
end up
very
qualifying for this trial, you can have LASIK performed on both of your eyes for no cost at all. It's
Wow.
free. Find out you can to see if you're a candidate. Call 866-400-EYES.
All right, long gone.